I think this would be a good time to transition over to our next topic of our agenda. And I'm super excited to introduce to the group Tyla and Jennifer from the First Legal Clinic. They're going to give us a little bit of background of what they do, and we can share kind of how our Washington chapter is collaborating with the First Legal Clinic in creating a toolkit.
Good afternoon, everybody. Thank you so much for having us here. My name is Tyla and I'm the executive director and also an attorney for the First Legal Clinic. I see some familiar faces here. So some of you, I think, know what the First Clinic is, but for those of you that do not, FIRST stands for Family Intervention Response to Stop Trauma. The trauma being the unnecessary removal of infants from their parents at the hospital. And to give you some background of myself, I'm an attorney. I've been a child welfare attorney for almost 14 years. I have practiced in every area of child welfare, from investigations through dependencies, terminations, adoptions. My firm represents parents and legally free children, or parents and children involved in dependencies, and also legally free children. And the way that we kind of came about thinking of the clinic was one, through our work, we saw a huge need. For me, one of the hardest, most difficult hearings that I would have to go to is what's called a shelter care hearing, a 72-hour hearing, which has to be held after a child is removed from its family. And for me, the cases involving infants that were removed from the hospital at birth, typically for substance use, were the worst. The reason being because you would have these parents who literally, a mother who just gave birth. Sometimes I've had patients or clients come in diapers, in wheelchairs, because they had literally just given birth the day before, they had just had C-sections. And prior to having this court hearing, which is extremely stressful and scary, because it is to determine placement of your child that's already been removed from your care. You're just meeting your attorney for the first time, who has probably received information about you 15 minutes prior to that hearing. And then you're going to go in front of a judge who's going to make a decision. And most of the time, those parents have already had a meeting with a CPS social worker, and they've already had a meeting with the department. And a lot of times in that meeting, what they heard was, you are not safe, we do not trust you, and you need to prove that you are going to get better so you can have your baby. And for parents that are already in a state of chaos, that are dealing with a lot of trauma responses, what we would see would be really broken people, shells of people who had just lost really the only hope that they had likely had for a very long time, which was an opportunity, a chance for change, and that had been taken from them. And in most of the cases that we would have these hearings, those babies would be placed out of care. If we were fortunate enough to have a client that showed up with a room full of family members that were very supportive and were able to pass department background checks and clearances, perhaps that child would be placed with relatives, but most of the time those children were placed into foster care. And for me, that was devastating, because we would lose a lot of those clients, especially the moms. They would feel so incredibly hopeless. And if they were dealing with substance use issues, they would fall deeper into their addiction. And that never made sense to me. It never made sense to me that we would take a family, literally destroy it, break it into a million pieces, and then say, okay, let's try to fix this and put this back together. And so my colleagues and I, we've been doing this a very long time. And by doing that work, we saw that there were moments of intervention in these petitions that we would receive from the department. Moments where mandated reporters, OBGYNs, concerned family members, treatment providers would be calling CPS and saying, I have a mother that needs help, a pregnant mother, and she needs help. And those calls were being screened out because there wasn't an actual baby that was at risk of abuse or neglect. And we would go into court and we would say, why didn't the department do something when you've had this opportunity? And the court and the department would say we can't. There's no baby, and that's not our policy, and that's not what we do. And the judge would agree and would place these babies out of care. We also had active caseloads, and on those caseloads, our clients would get pregnant. And when our clients would get pregnant, we would advise them. We would work with them throughout their pregnancy, and we would tell them, this is what is going to happen. This is what the department is looking for. These are concerns that they're going to have. And we would work with them on trying to alleviate those what would be considered safety risks by the department. And oftentimes when we did that, we would be successful in ensuring that that baby stayed with their parent. And in addition to that, their older children were returned to their care as well. So we knew that it was possible, but I think what bothered us the most was the inequity that we saw when we would get private clients that would come in who had the means and the privilege to be able to hire us and would retain us as their private attorneys, and we would be able to go into these meetings with the CPS social workers, with the department prior to the removal, and we would be able to come up with a plan that would work for the family and that would prevent the child from being removed from its parents' care. And so with all of this information, we knew something different could be done. And so with that, in July of 2019, we decided, let's try this. We're going to do this pro bono. Let's see what happens, and let's see where this takes us. And I want to give a huge thanks to the Washington chapter of the American Academy of Pediatrics, because we received their endorsement very early on. And that endorsement is what opened the door to a legal medical partnership and really got us into various birthing hospitals where we could present this plan. And what we were received with it was excitement. Everybody saw a need and thought, this is what we've been waiting for. There was a lot of apprehension and fear too, from hospital social workers, NICU nurses, and the department themselves. When we very first started in Snohomish County, we had a lot of pushback from the department. People, social workers saying you can't be here, you can't have an attorney. If they didn't hire you, you shouldn't be here. You haven't been appointed yet, and we would say, obviously, and we just kept pushing on. And so throughout the course of our work, we have established some really great community partnerships. And through those partnerships, we've been able to close some gaps in the system that we saw right away, that we, as attorneys, we didn't know existed because we were not in that prevention space. We didn't realize what was there. There was a disconnect happening at the birthing hospitals and with CPS. We didn't realize that clients were not able to have access to their child's hospital records, to their own records, that our clients were being asked to go and get a drug and alcohol assessment, sometimes the same that they had given birth, which would require them to leave the hospital, go sit in a waiting room and wait to see if somebody no-showed for their appointment. We didn't know that this was happening. And so by being in this space, we learned a lot of things. And what we did was we took that information and that knowledge, and we went to community partners and said, hey, would you be willing to do a drug and alcohol assessment over Zoom, over the phone? Could you go to the hospital room where our clients are and do this for them? And what we heard was, yes, absolutely. We didn't know that this was a problem. And so with that, we have really just exploded in ways that I've never actually envisioned or imagined. Everything moved very quickly and very fast. And I think that's because there is a really huge need for this service. We started in July of 2019 and really just working out of Snohomish County. Our intention was never really to leave Snohomish County. Our intention was to work directly within the birthing hospital in our community at Prov, to go there physically and to work with these mothers immediately after giving birth and support them. And then COVID hit, and that changed everything. And what we thought was going to completely derail us, put us in a position to serve everybody. And since we're unable to say no, that's exactly what we did. And so we since our inception, have appeared in department meetings, have worked in birthing hospitals across the state of Washington. I can tell you, as my partner likes to say, there's something called justice by geography, and that is extremely true. What you see and the variations from hospital to hospital, from department office across the board is so incredibly different. But we've been very fortunate to make some extremely strong, incredible partners. Specifically, the Addiction Recovery Services Unit out of Swedish Hospital, which started connecting us to pregnant mothers, and then we were able to move upstream a lot, which had been our dream, and then now working very closely with the START unit out of Tacoma, and then through word of mouth. And so we serve both parents who have recently given birth and also pregnant parents who are at risk of CPS intervention. And our goal is to prevent any type of systemic involvement that we can. If we cannot prevent CPS from coming and seeing this family at the hospital, then our goal is to make sure that that child is never removed from that parent's care, and that there's no court involvement. And we've been successful. So to date, we have worked with over 600 families across the state of Washington. 82% of our cases do not end up with any court involvement. A majority of the children that we serve remain in the home of either their birth family or extended relatives. We've grown huge since 2020. Well, 2021, we grew 140%. 2022, we grew 193%. We have some interesting stats that we have. 59% of the children that are served by our organization are identified as BIPOC children, which makes us extremely happy, since we know that BIPOC children are disproportionately represented in the child welfare proceedings. For us, the average amount of days that a case is open, even when we're working with mothers that are pregnant, is 89 days total. That's our average, compared to if a child is removed and placed out of home, that average number is 678 days in the state of Washington. And that is just out of home care, not the length of time a case is open. And then a third of our clients have department systemic involvement themselves as children. They were in foster care. And so we're really hoping that we're stopping that generational trauma that's occurring. We really couldn't do this without the support of our community. We never thought that we would be partnered with DCYF, but we are, and that has been an amazing partnership, where these meetings in which we would show up and be told, you can't be here, why are you here? We're now getting calls from the same people saying, where are you? We need you. This family needs you. And so it's been such a shift in culture. And I can say that in Snohomish County, that shift is palpable. You feel it in every single meeting that you are in, and it has rippled across how the county views these cases, because with the social workers recognizing if we are not removing infants and things are going well, then maybe we don't need to remove this 3-year-old. Maybe we don't need to remove this 9-year-old. Maybe we can actually work with this family and keep these kids in home. And so we have seen a huge drop in filings in Snohomish County. It has been just a really incredible, it's been the highlight of my career. And really how and why this works is because we work with parents with lived experience. And those parents are able to connect immediately to these mothers who feel a lot of shame, a lot of fear, and a lot of trauma about what is happening and what's in front of them. And so having somebody that has walked in their shoes, who understands what they're going through and can let them know, I have done this and it is possible and I'm here to help you. That is why we're able to do what we do. And so with that, I am extremely pleased to introduce Jennifer Justice, who is one of our parent allies, but also was one of our very first mothers. So Jennifer.
Oh, thank you, Tyler. You made me so emotional during that. Oh, I'm really, really honored to be here. and really honored to be a part of the First Clinic. I am exactly why the First Clinic is so important. In 2015, I gave birth to a child who was substance affected, and I didn't have the right supports. I had roughly 5 caseworkers through the department and about just as many attorneys in the 2 years before my rights were eventually terminated, with the judge telling me that love was just not enough. It devastated me. In 2020, I got pregnant again. And I went to the ARS Ballard program, and upon leaving, they gave me the information to the First Clinic, and I connected with Adam and a parent ally, and it literally changed my life. My child never spent one day away from me. I graduated, I attended and graduated college in this last 2 years. I gained housing. I have the best career in all of the world because I get to give back, because I get to show up for these moms when they're terrified. And I get to say that I really know what it feels like to be in their position. And I know what it feels like to feel hopeless and to feel unsupported. And I get to change that for them. And I get to help women and mothers stay with their children and have a voice. And that is extremely healing and powerful to me. Our job is not always easy, and there is lots of up and downs. But just in the 6 months that I have been here, there has been so much change, and I have helped so many moms. I think the majority of the moms that I have want to come back and do what I do. That is like their goal. Like, I want to come do what you do. I feel extremely blessed to do it. It is this work needs to happen everywhere. And I give so much credit to Tyla and the other attorneys, because 3 attorneys and 2 parent allies for the entire state of Washington. Let me tell you, it's a lot of work, but it is the most rewarding work that there possibly could be. I do too want to say that I am extremely grateful for working with the START unit and ARS. They have accepted me with open arms and absolutely enjoy having me there. I get to come in person. I have actually been there for the delivery of somebody's baby for a mom who had nobody in her life and needed someone to be there for her. I've bought clothes for babies and brought them in for parents who have absolutely nothing. And I am that person that they can call 24 hours a day, 7 days a week, no matter holiday or not, when they are struggling. And that is a gift that it's a gift to me, because it gives the worst time of my life purpose. And that's something I didn't think was possible. I have a lot of regret and a lot of shame still for myself with my children and my addiction. But every single day I get to heal, and I get to give my life purpose. I mean, I literally get to have a legacy in every single baby who gets to stay with their mom. And I have moms who cases close with us and still call me to this day just to talk or send me pictures of their babies as they've gotten older. And it is just the most amazing thing in the whole entire world. So I really want to thank all of you for letting me come and share my story and be so emotional, because it is super emotional. But I'm very, very grateful. And I'm very grateful for all of you who work with us and partner with us.
Thank you, Jennifer. We love you. And I can say, I'll humble brag for Jennifer, that a majority of the mothers that Jennifer works with do not have any systemic involvement. They leave the hospital and that is it. And that is our goal. Our goal is to try to keep these families from having to experience any type of trauma. And so Jennifer is amazing at her job. Thank you, Jennifer. And so another reason that we're here, which I'm really excited for, is that we'll be working with the American Academy of Pediatrics and in creating a toolkit for birthing hospitals, for professionals that work with the families that we serve. And the goal and hope is to educate and to close some of those gaps that we see as we're doing our job, and to really help just shine light on mothers like Jennifer that Jennifer didn't mention this, but she was turned away 5 times when she was searching for prenatal care because she was in active addiction and nobody would see her. And I think that that is something that is not known. I think there is a belief that if you look for prenatal care, it's there. You'll find it, and that is not true. We have a lot of mothers that that are turned away from providers every day, that are treated absolutely horrible in the hospital, and made to feel so bad about everything. And that type of treatment and shame is what prevents women from seeking prenatal care in the first place. It prevents them from wanting to give birth in a hospital. I can't tell you how many times we've had parents call and say, what care, I just want to do this at home. I can't go there because they're going to take my baby. And for us, that's terrifying. And so we're really excited to create this toolkit to help shine light on some of this, and also just to be able to open up the kind of the world of CPS to medical providers. I think that this is such a weird black hole, and a lot of providers are concerned about the mandated reporting laws, policies that are put in place by their employer, and then just fear of what they've been trained on and what they've been told. And so hopefully shining a little bit of light on that, on how to be able to assist these families when CPS gets involved. What can you do that can benefit them, and then just how can you support them? So thank you.
Thank you so much, Tyla and Jennifer, for being in this space with us. It's been a privilege working with Tyla over the last couple of months on the toolkit and as we outline it in draft. And we will be, as we continue to move forward in this toolkit, we will be, anyone who's interested in this work and being a part of it, please reach out to me. We are looking, to put together this gold standard of a toolkit for the state of Washington. And so now, I see Taylor has her hand raised. And so any questions? Taylor, can you kick us off?
Yeah, definitely. Wow, what beautiful work y'all are doing, and so important and so meaningful in so many ways. And I've already reached out to you, Tyla, and Jennifer, you've already reached out to me. We will be meeting to talk more. But you really said something very poignant, and that was that people are afraid to reach out to doctors for prenatal care. I've heard this time and again from so many different people. OBGYNs know this, midwives know this, and there's just such a broken trust, between our communities and their medical homes. And I think it's so important to point that out and to bring light to it. And that's actually something that we're doing here in Pierce County. There's a project at TPCHD right now that's focusing specifically on that. Like, where are the gaps? What are they, and how can we help? And so I was wondering if it's okay to connect you with more people, because I'm shaking right now, because this is something I'm so passionate about. It's something that I prioritize in my work every single day as the healthcare liaison for the Pierce County Early Childhood Network. And this is so important. And I'm kind of mad that this is the first time I'm hearing about y'all, because what amazing work you're doing. And I'm so glad I'm hearing about it now. But just wow, thank you so much for sharing. And is it okay that I connect you with a bunch of people potentially?
Absolutely. Yeah.
Okay.
I'll make all the connections.
Cool. You got it. Thank you.
Thanks, Taylor. Judy.
Yeah, and I just want to say again how great it is to have you here talking about the work. And I think there's one piece I want to add just to the power of the stories. And I just actually got the data that you shared, because even at DCYF, we fund First Clinic from 2 parts of our work: the prevention side, which is the team I work with, and then the side that's much more traditional child welfare. And it is creating great ripple effects throughout the agency for us to think about not keeping that so separate. Families deserve to have that respect, and we want to do all that we can to support families doing well and families being together. So I kind of have goosebumps because I was one of the people who knocked at the door before we were DCYF. We were Department of Early Learning and kept saying, hey, you get screened out families all the time. Can you help connect them to home visiting, to services that we provide? And the message from the attorneys for the state said, no, we can't do that. There's no child. It's exactly what you described, Tyler. And I said, well, you know, it seems like you could offer something because we have a lot of services that promote and support positive family development. Why can't we do this? No. So once DCYF started, they actually revisited that initial sort of legal piece. And now we have some of these pathways for screened out families. And it's one of the things that makes me really happy, because the notion is that for families to get those supports they need, whether it's help with housing, all the legal things that they have ahead of time, and build up their support network, at least have them understand what they will be facing, and with someone by their side, which Jennifer, you described beautifully, is what promotion and prevention is all about. So the ripple effect of the conversations that's forced the prevention and intervention people together to focus on that really important time period of relational health and the long-term trajectory of families has been super powerful within the agency, as well as the amazing work we're doing with families. So I just want to tell you thank you. And I know you work a lot with the people doing plan of safe care and the Harvard Government Performance Lab folks on the pathways, and those are things that like we talk about all the time because it's how we need to change the work. So just great appreciation.
Thank you, Judy. And as to we are part of a pilot project that DCYF has rolled out. So we now those screened out intakes that are being sent directly to us, and I can say that we are successful at connecting with those families. Last month alone, almost everyone that came to us, we were able to connect with. And what that means is that the second we connect them to a parent ally, we connect them to resources. And the goal is that that intake turns into nothing, that baby is born and then goes home. And we've had several of those success stories that came to us as a screened out intake, which likely would have resulted in a pickup. And so, yeah, it's been awesome. So thank you, Judy.
Tyler and Jennifer, incredible work and extremely relevant to the question that this body is wrestling with. Like, how do we build those bridges between the prenatal care and the postnatal care systems in a way that enhances early relational health, that increases or decreases the likelihood that families will struggle later on. So what I'm really curious about, I'm going to ask Tyler to ask you to get into the weeds a little bit. I'm curious about what actually is the toolkit, and like what are the elements in it? Who is that a toolkit for prenatal care providers specifically? And what aspects do you think of that might be useful, let's say, to the pediatric care team that might be caring for this reunited family after birth?
So the toolkit is still very much early in the works. The way that I envision it is that this would be a prenatal, labor and delivery, and postpartum plan, that it would be kind of following, it could be applicable across the board. I don't have my outline in front of me in terms of what I was envisioning. I know one of the goals is definitely along the way to work with my moms and my clients that have lived this and say, what did you need? Where were you falling through the cracks, and how can we have prevented that? I mean, I think that for the parents that are afraid to connect to prenatal care, then it is just, what can we do for harm reduction? What can we do to make sure that they're getting the prenatal vitamins that they need, that they at least have the education that they need to remain safe, and then connecting them with, we've just recently met with a group of midwives out of Providence. So the hope is that we can connect with them. We work closely with the harm reduction doulas out of King County, who provide amazing services for our clients. And so, Kehlani, do you have my outline?
Yeah, no, I think you summed up everything perfectly.
Okay.
I think from our member perspective, we have Elizabeth Mead, who's over at Swedish, and Kim Hoff as well, who are our chapter members that are kind of leading this initiative as well. They have shared multiple times on the call that, you know, PED providers are really in the dark. And so there will be a portion in our toolkit that will go over like the role that pediatric providers can play in this, or just in general family practice as well. So, but kind of early stages still, but that's kind of where we were headed.
Great. So excited to see how this plays out. I mean, this is, I think, such important work. I think I might have jumped the line a little bit. Tori, I know you've had your hand up for a while.
Yeah, no problem. I thank you so much, Tyla and Jennifer. I was the first Washington State OPD social worker, and so I love. This is my soul work, actually. Just hearing just how the parent ally movement has thrived since the mid 2000s. Starting with Brenda Lopez and Kim Mays, and anyways, it spoke to just so many of the things that really it center me on kind of why we're here. And I wonder, and this might be a question for a different day, and I'm definitely going to connect with you all. I've been actually meaning to do that for quite some time. But what are the barriers for expansion? I love the toolkit, love it. I know we can only expand, obviously, like at a certain pace, and you all have been expanding really just like with an impressive pace already. But I just see this as being kind of a best practice just as part of our family response system. This is ultimately differential response that we've tried to put in place for 10, 15, 20 years in the state of Washington. So are there any other plans for expansion, and what are the barriers, and would just love to advocate?
So right now, the Office of Public Defense has an ask that's in the governor's budget currently. And what that would do is expand on, so right now we have a legislative proviso that flows through the Office of Public Defense that was awarded to us in 2020. That money will cease at the end of this fiscal year. So Office of Public Defense is asking for, I believe, like $3.8 million. What that would do is double our budget to continue our expansion and growth, and then would hopefully expand prevention programs in 3 additional counties across the state of Washington. We are very hopeful that we can work closely with the Office of Public Defense to provide training to the attorneys and parent allies and OPD social workers that would be coming into these roles. I think that one of the barriers is money. It's always a barrier, and really we need good public defenders. You need good attorneys that have an understanding of child welfare law. This is a space that is very it's a niche, and you have to understand child welfare policy. You need to understand how the court is operating. You need to understand the culture. It would be difficult, while not impossible, for, say, a family law attorney or maybe a guardian ad litem or some sort of other attorney to step in to that role, just because you have to know what's happening across the board. You have to know how judges are ruling in your county, what the Court of Appeals is doing, what the Supreme Court is doing, everything in child welfare matters. And so I think that is one of the reasons that we've been able to be so strong, is because I'm fortunate to have a great team that has been doing this work a very long time. And so really just trying to find strong attorneys that that can show up. And the way that this work is like Jennifer said, 24/7. My team and I have been doing this since 2019, and I don't know that we have stopped since. Babies are born whenever they feel like coming. And so when that baby's born, we're on the phone, and we are making plans, and we're supporting that parent. Hospital social workers are talking to parents at all times. And I mean, I have had a CPS social worker show up to my client's room at 2:30 in the morning, which is completely unnecessary. But we're there, and we want our clients to know that you're not going to be in this alone. And so really trying to figure out how can we replicate this in a way that is sustainable, because not everybody is us. We just happen to be insanely passionate about this. So it's complicated. That's the short answer. Jennifer?
I know this is kind of going backwards, but I was looking over the plan over here in the chat and stuff, and I can't tell you how excited I am about this, because the moms that I work with on an everyday basis, I'd say almost every single one of them didn't receive prenatal care. And if they did, it was at ARS or START unit. And it was, their fear is that, their baby, I mean, I have moms, myself included, who planned with their friends, like, could we deliver a baby at home so we could avoid the hospital? It's a thing. And it sounds crazy, but it is the reality for a lot of moms. And the other thing is, I'd say literally every case I work with has no idea who their pediatrician is going to be or how to find one. And throughout their whole pregnancy, even while they're receiving prenatal care, it is something that is not talked about with moms. The doctors are focused on moms, which I appreciate so much. But now mom has had a baby, and the social worker wants to know the plan. And I'm talking to mom, and she's like, "What? Wait, I don't know who. Do you know a pediatrician around here?" And that's unfortunate. I, was lucky enough with my older children. I think I had like 5 interviews. I was the crazy mom. I was the mom who, the helicopter mom or whatever, I met with so many, and there's just, but that knowledge isn't knowledge to everybody, and the resources, and it's just not available to everybody. And Tyla is right. I tried for months to find prenatal care, and I don't mean at, I'm talking about at the health clinics, being turned away, being told that I was too far along in my pregnancy and too much in my addiction, and I needed to be on medication for MAT treatment somewhere else first before they would even see me. And I ended up in the emergency room in Auburn with a doctor who said, "That is unacceptable. I want to be your doctor." And as she handed me her card, I had pulled her exact card out of my purse and said, "It was one of your offices. Your office is one of the offices who refused to see me." And she was shocked that was a thing, right? And I think that it is a lack of just communication. I think that people aren't aware that these are issues, and I'm really, really excited about it, because it is so sad to me to think that somebody's not going to a doctor, for one, because they can't, and two, because of how scared that they are, and that the resources aren't there. And the other thing I hear a lot is that moms don't know about these programs that are out there to help them, like ARS and START. So many moms don't know. So many moms have children, and they're like, afterwards, like, I wish I knew that there was a program like that. And the information needs to be out there for everybody. And Eat, Sleep, Console needs to be at every hospital, because if we're lucky enough to work with a mom in the beginning stages of pregnancy, it makes all the difference. But for these moms who we don't get that opportunity, those 5 days isn't just wonderful for that mom to bond, but it is crucial for us to be able to come up with a solid plan that is going to make a difference in this mom's life, because otherwise we've got hours, and literally hours, to come up with something and make something that's good enough for the department to say, like, this sounds safe. And that can be extremely difficult.
Yeah, thank you guys so much for being here. I've got so many more questions for you guys. It might be worthwhile setting up a meeting at some point to pick both of your brains a little bit about what can change in the medical system, like magic wand stuff, that could impact care of these for these mothers and their children. But we are at time. And it's Friday, and you guys have been very generous with your time to be here with us today. but so we need to wrap up. One question before we go is we're trying to set up the next meeting. And one of the, we've got 2 dates in mind and just wanted to do a quick gut check poll for you guys. April 7th and April, what was the other one, Kailani?
21st.
21st. Any strong preferences for either of those for any of the people in this room, Zoom room? Okay, we want to work with a presenter. If there aren't any strong opinions, we'll kind of see which one works for our presenter and send you guys an invite real soon.
And if you're willing to hold those 2 times, we're wanting to really get our momentum back with this group and increase our turnout. So if you could hold those 2 times, 1 to 3 on those 2 dates, we'll only ask you to meet once, but then we'll make sure that we have good turnout. And this conversation has been really wonderful and really helpful to us, because Kailani and Tatiana and Rachel and Marianne and I were in an earlier meeting today talking about this group and what we could accomplish. And one of the main thrusts of the meeting was pregnant people's mistrust of medicine and how that transfers to their mistrust of pediatricians or family physicians who are taking care of their children. And if we can't have trust as the mother or pregnant person with their care provider, then we can't do the best job for that family when the kid is there. So this has been really relevant, I think, to what are our opportunities to build bridges across provider types. Really, really helpful. And I'm sorry that Judy Kimmelman isn't here today. She represents the Obstetrician and Gynecologist Association of our state. But I think there's huge opportunity when you see the outline of the toolkit, and I really will let you go because it's 2:33. But when you see the outline of the toolkit, I think there's huge opportunity for us to push this toolkit before the birthing hospitals, right? We're very focused on the birthing hospitals because those are sort of our people, right? Pediatricians, they're there to check out that brand new baby, and they can have this interface with the person who's just had a baby. But I think that we can really reach out to the family physicians and the OBGYNs with this toolkit as well, and doulas and midwives. So I think it's really super exciting. And I'm so grateful for everything you do at the First Clinic. So grateful. And Kailani, we're so lucky you're on the team to help build the toolkit. Yeah. Thank you. Great conversation.
Go upstream, right? Let's go upstream.
Yeah.